Hello friends, welcome to my channel. I'm going to start a course on oral pathology. This course is exclusively for students who are taking this subject for the first time. In this course, I'll be dealing with all the important topics which as a student you are expected to know. I have designed my videos in such a way that once you see my video, you will have a clear concept of all the pathologies resulting into diseases. And more importantly, you will see that after watching my videos, you will be capable of retaining it for a long time. So, in today's video, I'll be introducing you to oral pathology, and at the end, I'll be giving you some study tips. So, let's first look into the definition of oral pathology. Oral pathology, it's a branch of dentistry and a discipline of pathology which deals with nature, identification, process, and management of diseases affecting oral and maxillofacial regions. This is a very technical definition for oral pathology. Let's see what do we call in common terms. In simpler terms, it deals with the overall knowledge and understanding of all the diseases which affect the oral and paraoral structures. Now, what are paraoral structures? Structures surrounding the oral cavity or the mouth are known as paraoral structures. Now, let's see what do we study in oral pathology. We study about various diseases affecting the oral and paraoral structures, which I've already discussed. We study the causes of the diseases, then identification of such diseases both clinically and histopathologically. Now, what do you understand by the term histopathologically? Histopathologically means pathological changes brought about by diseases at the tissue level. These changes can be seen only under a microscope. Next is histopathology of lesions occurring in different diseases. We study the histopathology, which is nothing but changes at the tissue level of different lesion caused by different diseases in this subject. Lastly, treatment of diseases. We even concentrate on the treatment of diseases in this subject. Now let's move forward to study tips. I have seen many students struggling with the subject and that it is very volatile and it's difficult for student to retain it. So I have come up with some useful study tips. Let's see the first step is to understand the name of the lesion. Now, for example, I'll take a name of a very basic lesion. Suppose periapical abscess. Now let's understand why is this lesion named so. Let's understand why this is named like this. First, what does peri mean? Peri means surrounding. Apical, it means over here it refers to apex of the tooth root. An abscess means pus filled cavity. Now, with this, we understood that periapical abscess means pus filled around the root apex. Now, why I'm saying this is a very basic example I have taken, but why I'm concentrating on this is because whenever you come across a new lesion, you try to figure out why is it named so. Most of the time, the names of the lesion will tell you their etiology, their morphology, and even their location. Once you understand this, whenever you come across this lesion, the name of this lesion again, you can easily recollect its characteristics. That's why understanding the name of a lesion is very important. Now, coming to the next study tip, always study by looking at the pictures of the lesion. This is very important because of two reasons. First one is pictures help you in identification and diagnosis of a particular lesion. And the second thing, always have a color picture whenever you're studying. Never go with black and white pictures. Now, how it is helpful in identification and diagnosis is at the end of the day, you will have to diagnose it in the patient's mouth. You will be able to do so if you, while studying the lesion, if you see the pictures, you will have it in your mind, and whenever you see it in the clinic or in the patient's mouth, it will be easy for you to identify it. The second is the color of the picture. Why is the picture should be colorful? It's because the color, it defines the nature of a lesion. Here I'll give you one example. Suppose there is a lesion which is pink or red in color, and there is a lesion which is white in color. Okay, the red defines inflammation, which means infection or swelling or increased blood flow, whereas a lesion which is white, it defines that there is increased keratin production, which gives it white color. So while looking at the colorful pictures, you got to know more about the characteristics of a lesion. So it's always important to study by looking at the pictures. Now coming to the next study tip. Do comparative studies. Whenever you read certain characteristics of a lesion and you think, okay, I have studied this lesion with similar characteristic elsewhere. So what you do is you just rule out the similarities and dissimilarities. Okay, similarities and dissimilarities or differences. Remember one thing, always the differences will be less compared to the similarities, which will be more. So be smart and try to remember only the differences. Now, the last study tip which I'm going to give today is draw your own diagrams and flowchart for pathogenesis of diseases. This is very, very important. This is important because it helps you to understand the concepts You'll be clear with the concepts. This is the first thing. And more importantly, unlike the Western system of education, Asian system of education requires a student to spend 3 hours writing or solving a question paper. But surprisingly, the student will have only 5 to 10 minutes to impress the examiner or the evaluator. So how do you impress your examiner or the evaluator? The evaluator will be looking at your answer and he'll be wondering if the student is clear with the concepts or not. And he'll definitely not end up reading all your big lengthy answers. He'll definitely not do that. You're going to impress the examiner by drawing diagrams and flowcharts. By this, in a very less period of time, the examiner will get to know that you are clear with your concepts, and this in turn will fetch you more marks. More importantly, when you draw diagrams, as I've already said you yourself will be very sure about answering the questions. Next thing, in my next video, I'll be talking about basics of oral pathology, within which I'll be dealing with the basics or the common terminologies which as a student you are expected to know. And more importantly, I want your reviews. If this video was helpful, please like, share, comment, subscribe, and even don't forget to click the bell icon to get updated with the latest videos. I need your reviews because I want to know if is my voice quality clear, is the way I'm explaining is it clear or not, because I'm doing it all for the students, so I really want the students to benefit out of it, and that I'll continue making videos on oral pathology for the benefit of students. Thank you very much.